from an early age, Riley said he wanted to become a city hero. Our schedule was to go on Friday, have chemo done. Once chemo was completed, he would go visit a fire station and hang out with some of the men and women of the fire department. Riley has an infiltrating astrocytoma located in the hypothalamus of his brain. As part of Parenting 101, you are not told that these things can happen. You hear of these things, but you don't think about it for your own child.
Riley asked me one day in bed, why did this happen to him? What did he do to deserve this?
Unfortunately, because of the location of where his tumor is, it's inoperable, with less than a 1% survivability rate if resection is attempted. When we came to Nemours, it made it definitely a lot easier. It takes a lot of the stress off the entire process.
Everybody was just so nice and caring, and they were willing to do whatever they needed to do to help us.
Yeah.
I don't think we would have gotten through it without the doctors and nurses. And now we consider them our family.
Yep.
When we treat children with cancer, it's not just the children, it's their whole family. So sometimes the non-medical pieces are even more important or as important as the medicines we give. There are a number of things that I think really make care at Nemours something special. One is that we have the resources and the skills to treat virtually any type of cancer with any kind of treatment the patient might need. We have the Nemours Center for Cancer and Blood Disorders, which is really a collaboration of all of our campuses in Delaware, Jacksonville, Orlando, and Pensacola. And so we are really able to harness the expertise from all of those campuses. When we're combined, we're one of the largest pediatric hematology-oncology providers in the country. There are so many parts of caring for a child and a family when a child has cancer that are not the things that are covered by traditional insurance companies. The funds we're requesting are going to help us with our mission. They will help us make sure that we have the best treatments available for our patients, that we're able to train new physicians, and to be able to really look at patients or families as a whole, and that is the legacy we need to leave in our community.
After he completed 52 weeks of chemotherapy, the tumor has remained stable. As part of what we can do is hopefully raise awareness and raise money for future families, because unfortunately they're going to still continue until there's a cure found.
There's an old quote that it takes a village, and nowhere is that more true than when a child's been diagnosed with cancer. And again, that's the kind of thing that the fund helps make sure that we continue to win the war.